Hi Leadership Perryton. I'm Leroy Schaffner, CEO of Ogletree General Hospital District. Thank you for taking time to visit our hospital, and as a virtual tour, I'm sure that it will be interesting to you and hopefully informational. The hospital district is set up with a board of 5 directors. They serve as elected members of the board, and they serve 2 to 3 year terms each. The board of directors is very involved in the operational aspects of the hospital and oversight, and also are very active in the community itself. Okay, we are currently updating our OB services. The C-section room will be completed by the end of March, and a new x-ray room will be installed by end of March. That is the beginning of our long-range plan to increase the size of the hospital and increase the services. The next step will be to build on a surgery room, which will have 2 surgery suites and will allow Dr. Blastingame more room and quicker access to surgeries. OGH Hospital District has formed a foundation. The foundation is in the process of raising money to help us facilitate the expansion of the hospital. Currently, we have a little over $3 million and are currently working on getting grants, and we'll have some activities for the community during the next year if COVID allows. The foundation board is made up of individuals from around the community that support the hospital and work hard to support the community. Our staff is made up of local nurses and local individuals that take care of you as their neighbors and as their friends and as their family. Very proud of the service that we provide and of the services that we provide. Our physicians are excellent physicians, and they work hard to take care of the community.
Hi, my name is Curtis Parker. I'm the business office manager for Ogletree General Hospital. Yeah, so the business office is really comprised of 2 functions. The admissions function, which is the front end part of the hospital, registering patients and all that kind of stuff. And the back end part of it is the business office part of it, where we bill out the claims, the charges that you have when you're at the hospital to your insurance companies or work comp, lots of federal programs, and then also private pays. And there's lots of customer service associated with each of those on the back side and also on the front side in admissions. So let me talk about the 2 pieces of my job duties, the admission side and then the business office side. So the admission side is people come into the hospital, typically right now through the ER door simply because of COVID, and they get asked several questions, and we just want to do that to protect our patients, to protect our employees. They'll ask you some pertinent questions about, have you been around anybody? We will take your temperature. If you're good to go, you'll get registered with our main registration. There's 2 ladies that typically sit there. Or if you come into the ER, you'll get registered through the ER. They'll ask you pertinent questions about your visit. Typically verifying demographics for you, verifying emergency contact information for you. We want to make sure that we get all that information accurate so that if there is something that we need to call you on or an emergency contact, that we can get a hold of them. We also verify insurance information if you have that. It doesn't have to be insurance for your visit, but when you come in, we just want to get all that information accurate. We'll typically get IDs from the patients that are coming in, whether that's a driver's license or a state-issued government ID. We might get your ITIN number if you have that, or Social Security card, and if you do have insurance, we'll get a copy of that. The second part of the process is really the back end side, and it's called the business. We call it the business office. So they're responsible for actually sending out those claims to the insurance company or sending those statements to the patients if they don't have insurance. So there's lots of fun, let me say fun, air quotes, fun, on things that change from the insurance company perspective. Typically CMS or Medicare is the one that typically derives all of that information. So if Medicare changes something, it's not too long behind that most of the commercial carriers or work comp carriers will kind of follow what CMS does. So with that piece of it, CMS is all the time changing some rules. There's lots of different codes that go into billing an insurance company. Typically we will send demographics on the patient, insurance information, are you the spouse, are you the dependent child, or are you the guarantor on those claims? And then there's lots of other codes that go along with it. There's lots of diagnosis codes, there's lots of, they're called CPT codes or HCPCS codes that go into what the procedure is that you received. Those are different in every department. Lab have their own things, surgeries have their own things, radiology, nuclear med, sleep studies, all that stuff. Inpatients have their own stuff. So there's lots of challenges on the insurance side, but I think we do a really good job of keeping up with those ever constant changes on the business office side. The last thing is really just the statements that go out. Most people see that they have a statement if there is a balance owing. So we're very open to receiving any questions that you have. We want our patients to make sure that they understand what they're getting billed for. If they have any questions, of course, they can call the hospital and talk to any one of our employees about that. So the hospital also has several payment programs related to people that are in need. When I talk about people that are in need, there are lots of possibilities. It may be the scenario of, hey, I had a car accident and I had a surgery here. So you have this astronomical this expensive bill in front of you. You may be a working professional, you may go to work, you may work 80 hours a week, but this is just a bill that is a lot for you financially. There's also programs for charity care. Maybe you're out of work. This last year with COVID, there's lots of people that are out of work and have a financial difficulty. So the hospital does have programs for people that are in a financial crisis or in need. This is a county-owned hospital. It's paid through taxpayers in this county. So all of that kind of stuff is important, that we take care of the people that are living in this community and also the people that come here from outside the community. So if there's ever a need for that, there's a process for getting enrolled in that program and approved through that program. But if you know of somebody or maybe you are one of those people, just contact the hospital and we'll have you go through the process of getting enrolled. So kind of my last thing to talk about here is it's not just a job. This is not just a job to me. The admissions and the business office staff, I truly don't believe that it is just a job for them. They show up to work every week, every day, all that kind of stuff. We truly do care about the patients that we're serving. My opinion is also that if I'm not here for our patients, we are in the wrong. Whatever we do through the admissions and business tasks that we have, the job that we have, if we're not here for you, and that's what I try to give to the employees that are in my departments, is that we are here for you as a patient. We care about you. Short story for me is I lived in the DFW area and worked for big hospitals down there. And I think the difference between that and living here in the Panhandle is we care about you because we see you at the ball games, we see you maybe at the bank, we see you at the grocery store sort of deal. It is a hometown feel, so we truly do care about you and want to do the best by you and respect you as a patient. We want you to come back. We like caring for you in this community, in this hospital.
Jimmy Kennard. I'm the Assistant Chief Nursing Officer, Trauma Nurse Coordinator, and Infection Control. Aqua Tree General Hospital is a certified level 4 trauma facility. This year, whenever we had our recertification, we had 0 deficiencies, which we're very proud of. Being a trauma center means that we are perfectly capable, and every single one of our employees in the hospital is certified to help you from the time you walk into the door until we can get you sent to a higher level of care. Our doctors, nurse practitioners, and nursing staff are all fully capable of taking care of someone from beginning of life to end of life. We can take care of anything from just the regular common cold to a major trauma, to heart attack, a stroke. We're all certified and well trained. Our physicians and nurse practitioners that work our ER are all well trained, and we're very proud to have them all. Infection control at our hospital normally is watching what people do, making sure that they're washing their hands and wearing gloves and things like that. But as we know, 2020 brought different ideas for all of that. And so infection control is pretty much, COVID has taken over that as with the rest of our lives. So we've concentrated a lot on COVID and infection control policies throughout our hospital. As everyone knows, things change day to day with the CDC, the state, all the federal levels, and there's an entire team of us that stay on top of it, and we're on phone calls several times a week. We get numerous emails, and we just go with the flow, and we just keep everyone in our facility as well as our town as safe as we possibly can. Aqua Tree General Hospital is staffed 24 hours a day, 7 days a week, 365 days a year with local staff. We have 5 physicians and 3 nurse practitioners that rotate a monthly schedule. We also now have Dr. Blessingame here as emergency surgery, and he's able to take care of a lot of things that we once had to send out of here, and we're able to keep you at home and get you home sooner. By staffing our ER with local providers, you can be assured that you will be treated like family throughout your stay. Our doctors, nurse practitioners, and nursing staff all stay up to date on the latest technologies and techniques in order to keep you here at home.
Hey y'all, I'm Megan Blassingame, and I am the head of the anesthesia department here at OGH, and have been doing this here for about a year, and have been a CRNA otherwise for just over 4 years, and am so thankful to be here and doing this for our community. Anesthesia offers a wide range of services here at OGH. We do anything from general anesthesia to epidural and spinal anesthesia for obstetrics to moderate sedation in the ER or throughout the hospital for those needing just a little bit of anesthesia to make sure that they're comfortable enough for whatever procedure is going on. So for general anesthesia, that's as if you're going all the way off to sleep for any kind of general surgery case, any kind of orthopedic case that we might be doing, any kind of colonoscopy or scope cases that we've definitely picked up on here lately. And the main part of that is getting you comfortable enough to go off to sleep, have the procedure done, and then most importantly wake you up afterwards and get you back to recovery. Besides general anesthesia, we do a lot of OB cases here, and we offer spinal anesthesia if you were back here in the OR for any kind of C-section, or epidural anesthesia to help with contraction comfort during the labor process. And then we also offer what's called nitrous oxide here at OGH, which is if you choose to forego the epidural anesthesia, then we have some nitrous oxide, which is a gas that you can actually breathe. That doesn't completely take the pain away, but sometimes helps mothers who are farther along in their labor process to just kind of take that edge off a little bit to try to get us through the labor process before we have that baby. Anesthesia can definitely be a scary part of any kind of procedure that you have to have done, but we have a great staff here, and we truly care about our patients and just want you to feel as if you can trust us, because it's the part of everything when you're totally asleep, and you have us here to watch over you and to take care of you and to be here with you throughout the process from the beginning until the end, until you're awake and ready to go home. We Have a great staff here. It's either anesthesia department is either myself or Josh Stevenson, who has been a CRNA for many years as well. Our anesthesia department is so thankful to be here to serve the OGH community, and we look forward to seeing you in whatever aspect you come to visit us with, and look forward to taking care of you to the best of our ability and get you home safely.
Hi there, I'm Jenny Barnes, Director of Radiology at OGH. Little information about our department here. We offer our basic x-rays that everybody knows about. We also perform CAT scans, MRIs, ultrasounds, mammography, and bone densities. So something that many people may not know about our department is it's very unique for a small town like us to have a radiologist come on site. That is the doctor who interprets every exam that goes through this x-ray department. So he comes on site and we can do pain intervention procedures, meaning spine injections, joint injections. It's done under a sterile field with anesthesia, so the patient doesn't feel any discomfort. And we inject steroids into the spine and or joints to alleviate pain. Also, should a woman present with a lump in her breast, we are able to diagnose here at OGH. She'll come through the x-ray department, get a mammogram. Our doctor will read that, and we can go to a sonogram to get a better look at it to help distinguish what exactly it's made of. And should we have the need, we can also perform a breast biopsy here. Those results are sent off for pathology at an outside lab. And every step of that process, the patient gets to remain here at OGH in her hometown rather than having to drive out of town. One of my most favorite things about our department is our patient interaction and our continued years-long relationship with our patients that we see over and over. There's a couple of us here that have been working in this radiology department, myself for over 20 years, and I've got a couple of other techs that work along beside me that are very near to that 20-year mark as well. So patients around town, they know our face, they know our names, they know we're going to take care of them. We see patients downtown and they remember and come say and tell us follow-up of what has happened to them since the last time they saw us. The best part is the mamas that we see. We may follow that pregnant lady for 9 months after pregnancy, looking at her baby and telling her what the sex is and giggling and laughing with her, and then 3 more months down the road, we'll run into them at Pizza Hut and they come open up their car seat and show me their baby that we've been looking at for 9 months. That's rewarding to us. I have a gentleman friend who called me one time on a Sunday night, and he says, Jen, my wife just felt a lump in her breast. What do I do? When can she come see you? And my immediate response was, tomorrow morning. I'll put her on the schedule as soon as I get there. You get her there to see me, and we proceeded that next day and with the appropriate steps, did a mammogram, did a sonogram, and biopsy, and she was on her way for treatment for breast cancer. That is rewarding to us. A patient that knows that they can have comfort in us, that we see them at their weakest, and we get to be that strong point for them. I don't think you get that in the other towns where you never see that tech again, or if you do see them downtown at Walmart, then they're not going to know who you are. But here in Perryton, we know our patients and we genuinely care about them.
My name is Tony Black. I'm the lab manager at Tree General Hospital, the clinical lab. I've been here a little over a year. In this past year, we have brought in new instruments in nearly all the areas that we take care of everything that is removed from the human body, from tissue to fluids to blood. We analyze it, tell the doctors what's in it, and give them the answers they need to take care of our patients. Most of our samples are done in-house within hours of being brought into the lab, same-day results. One of my primary missions when I came here was to decrease the amount of samples that were being sent to large reference labs, which takes many days, and frankly, they don't give as good a results as we do. One of the things that we've brought in this year that a lot of small hospitals have never been able to do is we do our own PCR COVID testing, which PCR is the standard for the best result for COVIDs. We have our results out within 1 hour. That allows our doctors and our nurses to take care of patients without worrying about whether they're infectious or not, and to take precautions if they are. We've also brought in testing for lead testing for newborns. This was all being sent to the state, and we now do same-day lead testing on the newborns here. We have added many hormone tests here that test for thyroid function and other hormones that the doctors need for treating women in town. And our cardiac testing, we have implemented a troponin high sensitivity assay. We were the first in the Panhandle to bring this assay on board. The hospitals in Amarillo are currently validating and bringing that test up, and we've had it now for over a year. Within the last year, the district has invested a large amount of revenue in updating the lab and bringing the most modern, sensitive, and accurate instrumentation into this lab. This lab can compete with any large lab in any of the big cities right now. Our staff, they are all board certified, degreed technologists, our phlebotomists. We get samples without hurting people, and we've invested in money to get them equipment to do that rapidly without causing people pain to remove those samples. Our goal is that every sample we take, we treat it just like it's one of our family.
Hi, I'm Candy Pickett. I'm the social worker here at the hospital, which in Perryton, America, that can mean a variety of different things. I think my description of social services means either helping people or connecting them to the resources that will help them. One of my main jobs here at OGH is discharge planning, which basically means that I help people get the things they need to be successful wherever they're going after they leave us, whether that means connecting them with home health or medical equipment, even oxygen, or it could mean going to another facility. For instance, a patient that has had a stroke and needs long-term intensive rehab, or even a nursing home. I not only work with inpatients that are in the hospital, I work with patients out in the community too. I coordinate a patient assistance program with medication for patients who don't have insurance or the income to purchase medications, sometimes very expensive medications. I coordinate a car seat program which helps low-income people that drive on Texas roads, not just Texas residents, be able to get a car seat. Some of the other things I do are that I am a Medicare benefits counselor, which means I can help people kind of muddle through that Medicare process, whether signing up for Medicare for the first time or helping them check their prescription coverage through Medicare. We also have a swing bed program that I help a lot with. It's basically where people can come after a short hospital stay, a 3 midnight hospital stay, to get some rehab care. And their hospital stay can even be here at OGH. We actually don't have swinging beds, which is one of the #1 questions I get about swing bed. It's basically that our beds can be used for acute care or rehab beds, so Medicare just coined the phrase swing beds. I think things that I enjoy most about my job is #1, that I'm never bored because there's always something new that happens that I either don't know about or I have the opportunity to learn about. And 2, that I get to feel like I make a difference, whether it be helping somebody install a car seat correctly or finding the resources they need so they can be safe at home and return to their home, or, muddle through that Medicare process that's confusing even for me at times. So I'm grateful we have the community that we have and the amazing hospital that we have that gives me that support.
Crossroads is counseling for older adult population on Medicare. Normally Medicare with a supplemental insurance that comes with it. It's a Medicare funded program, And what we do is group therapy. We offer group therapy, individual therapy, couples therapy, family therapy, kind of a wide variety of things. People that are 65 and older, or if they are on a Medicare disability and if they're really having a difficult time, I like to call it with life adjustments. Whenever, a lot of times after retirement or whenever certain health issues hit and people have to quit living the way that they once were, all these big adjustments happen in their life and they don't quite know how to cope with it. So what we do is we kind of have open arms for people that are with this, what do I do now and what do I do with how I'm feeling? And so they contact us, or their loved ones contact us, and we kind of do a screening process, see what's going on, what needs they're having, and get them into our program where they're able to realize they're not alone in what they're going through. There's some different things that go on. Everyone kind of has their own path that they're walking, but they're also not alone in what they're walking on. We kind of what a typical day work looks like here is we do provide transportation for people who can't drive. We have a bus that will, if you are in wheelchairs, if you're wheelchair bound, then the bus can hold, is it 1, 2, 3, 4 wheelchairs at a time, plus we just regular seats. We have a lift, and the bus picks people up, takes people home in a 30-mile radius. The normal morning kind of looks like everyone comes in about 9 o'clock in the morning. We have coffee, we have fruit, we have some snacks. If you don't like coffee, we have refreshments. And we have a 9 o'clock group, a 10 o'clock group, an 11 o'clock group, and then we provide lunch. And then kind of the sessions are over for the day, unless you want to stay for some individual stuff to kind of talk on the side if you don't feel like speaking freely with everyone else. Then we have myself and another counselor that works here in the program. She's currently a LPC associate, so she's getting those internship hours right now so that she can be fully licensed. And we kind of work together to come up with a plan. We also have a RN that works full-time with us that manages medication with doctors, kind of manages blood pressures, to make sure that we're staying on top of health issues as they're happening as well. And we also have a doctor that specializes in medication management for depression, anxiety, any kind of big life adjustment that's going on that sleep. That's the other one, I couldn't come up with it. And he's a nice doctor. He is out of Wichita Falls. His name's Dr. Barnhart, and he works with us. He sees patients twice a month. The hardest step is the first one, because it's the unknown. And for us, whenever we're having a hard time, or even if we think we're just having these big adjustments, we don't know what to do with them, the hardest part is taking that first step, because we don't know what's waiting on the other side of the door. And I do encourage people to just take that step, and you never know, it could be such a big life changer for you.
I'm Kelly Judice. I'm the Chief Nursing Officer of Ochiltree General Hospital. Nursing service is composed of many different areas. We take care of medical patients, surgical patients, OB and newborn, and ER patients. On our OB wing, we can take care of 6 moms, 6 or maybe a few more babies if needed. We like this to be a family-centered area. We want all of the family to be involved. We've made accommodations for the dad to have a queen-size bed to sleep in, and the mom as well if she chooses to. We want them to be comfortable, to make this feel like home even though they're not at home. We also have refrigerators in the rooms for the patients to be able to put their favorite drinks in if somebody brings them a drink or a snack. We do provide some snacks, but sometimes families like to bring in their own foods from home and leave them here, which is good for everybody. In our nursery, we do have a nursery here. We let the parents decide whether or not the baby goes to the nursery or stays in the room with the parents. It is totally up to them. We don't have a preference either way. There is a time before discharge that we have to take babies to the nursery to get a weight and get vital signs and things like that, but we bring them right back. Doesn't mean they have to stay there for a long period of time. We do have an infant security system on our OB wing, and when the baby's born, they have a bracelet around their leg, and if they get close to any door, all the doors lock, and if somebody tries to open it, then the infant security system alarms and will not let anybody out any of those doors. For the moms in labor, we have a centralized monitoring system. We can see it in the room with the computers that are with the monitors. We can also see it at the nurses station, and any of the nurses working in any other department, they can also pull it up on their computer. If there's a question about something, they can ask another nurse and they can get their opinion on it. The doctors also have it on their computers so they can monitor the fetal monitor strips, as well as the nursing staff monitor it. It helps provide the doctors with the up-to-date information, and it provides the nursing staff with information that they need when they're not in the patient's room. One thing that I would love for our patients to know is we care greatly for all of our patients, moms, babies, and we want you to know that we would treat you as one of our family members. There's not a nurse here that wouldn't care for you like they would their family member. They wouldn't deny you any of that care, because this is more like a home and environment, and you're more of a patient. You have a name, you have a better relationship with the nurses here than somewhere else where you may just be a number.
I'm Caitlin Sell. I'm the Respiratory Therapy Director at Ochiltree General Hospital. I'm a registered respiratory therapist and a respiratory care practitioner. Both are just the licensing and national registries technical terms for what we do. Here at Ochiltree General Hospital, you can see us working all over the hospital, from the ER to inpatient, outpatient, nursery, OB, OR. We do just about a little bit of everything here. We do your standard breathing treatments that most people associate with respiratory therapy, but we also do much, much more than that. We do pulmonary function tests, which a lot of people are not aware of, that can be done here. All you have to do to get one of those done is meet with your primary care physician, and they will write you a script if they see necessary that you have one, and you can come see us for fun breathing exercises. Another thing we typically do are ABGs, which monitor how well your lungs are working. So a lot of people don't think that respiratory deals with blood, but we are vampires too, just not as much as lab is. We go in on every C-section to take care of sweet little babies and help them transition into the real world. Another thing we do as respiratory therapists is EKGs. A lot of people will come in just to have them done pre-procedure. We see a lot of out-of-town doctors order EKGs before any kind of surgeries on their patients, and so people can come here if their doctor's in Amarillo for an EKG, and we can send those right along to your doctor in Amarillo, or even here if you're seeing Dr. Blassingame. Or sometimes the doctors just want a regular tune-up on your heart to see how things are working, and we can send that to the doctors here too. We have a lot of exciting equipment that we've come across here recently. One of the most exciting things we found is Vapotherm. It is an oxygen delivery system that just gives you comfortable oxygen to breathe. The oxygen you get from the wall outlets over here can be very cold, very dry. This is warm, humidified, body temperature oxygen, so it's a lot more comfortable. So hopefully you're never in a position to need that, but if you do, come see us. We can get you taken care of. During this COVID season, we've kind of been pushed to the limits a little bit here, just like every other hospital has, and we've really got to see what we're made of. Experience-wise and patient load-wise, we've been running some BiPAPs and ventilators here. Not the most fun thing to do, but we can certainly take care of you if it comes to that. Another exciting thing that we have to offer are solo patches, which is a little wearable device you just wear on your chest, small, portable, mostly inconspicuous. And you can wear it for up to 7 days, and it monitors your heart rate, your rhythm, can identify if there's any arrhythmias or anything weird going on there. So if you feel palpitations or funny little beats, go see your primary care physician, and they might decide that the solo patch is the thing that they want to try on you. We can certainly get you set up and taken care of.
Hello Leadership Perryton, I'm Melanie Scholenbarger, Department Manager of the Physical Therapy Department here at Ochiltree General Hospital. Can't believe it, but I've been working here now for 22 years. What I love about working here is I know most of the people I get to see because I grew up here. So I was born in this hospital, graduated from this high school, and now I get to take care of people that I've known all my life. And so it's a pleasure to work at Ochiltree General. As far as what physical therapy is, basically if you have any kind of functional decline, whether it be from being sick and you're just really weak, or maybe you've had some type of surgery like a knee replacement or an ACL reconstruction or a shoulder surgery, back surgery, we can help you regain your function to be more at the level you would desire it. Some things we do that a lot of people may not realize that we work with is we also do wound care. Like if you have a wound that's very slow to heal, maybe from diabetes or something like that, we do what's called sharp debridement, where we actually use forceps and scalpel to do very tiny amounts of removal of dead tissue so that we can facilitate that wound to heal. Another thing that we do that people may not be as familiar with is we can treat vertigo. If you have the type of vertigo that's positional, where if you move your head a certain way the room spins and it's very debilitating, we can take you through these certain motions to put these little calcium deposits that have gotten out of place in your inner ear back where they belong, and it's like a magic wand. The vertigo is cured, and so that's a really fun treatment to do. But it's really nice to have a physical therapy department here in Perryton so that you don't have to drive any distance to do your therapy, because typically we'll see patients twice a week for maybe 4 to 6 weeks. Sometimes it can be much longer, possibly 3 or 4 months, depending upon what we're seeing you for. And so it's nice to not have to drive somewhere out of town frequently to get that treatment. So if you or your family are in a situation where you feel like you could benefit from physical therapy, just to kind of let you know how it works, we do have to have a referral from a physician, and then you simply call and make an appointment. And when you come in for that first visit, we do an initial evaluation where we talk to you and get all of your history and also take functional measurements of your range of motion, your strength, what things are difficult for you, and that way from that initial evaluation we can make a plan of care of what type of physical therapy is going to benefit you the most. And then as far as the different types of treatment we do in physical therapy, we use anything from stretching, strengthening exercises, joint mobilizations, therapeutic exercise, balance training, gait training, things to help you regain your motion and your function, as well as different modalities like to decrease pain, like possibly ultrasound or electrical stimulation. We can do traction on the neck and the back if you're needing some separation, get a little taller. And so there's lots of different things we can do in physical therapy to help you regain what you desire in your life. Physical therapy is very important because if you have something that is not physically functioning in your body as well as it was, and a lot of times people will just say, oh, I'll give it some time, it'll get better. But then sometimes whatever's going on can just get worse and worse and worse with time as the mechanics of that joint or that limb get worse and worse. And then they can start causing problems in other areas of the body because how you're compensating and substituting to get things done despite this pain or this limitation that you have. And so it's important to go ahead and address things early whenever you have something that you know is not working like it should, or you would like to see if you can get better. It's important to go see your doctor sooner rather than later to see if physical therapy is something that can help you. I'm really thankful that we have had our new building now for 4.5 years. We are not actually located in the main hospital building. You actually drive around the emergency room side of the hospital, and we have our own building back here behind the hospital for physical therapy. And that's been really nice to have more space to be able to do what we need to, and also very convenient for patients to not have to walk through the hospital to get to physical therapy. So we've been very happy with getting to be in our own place.
Perryton. I'm with Ogletree General Hospital Home Health and Hospice, and I'm here today to kind of explain what services we provide for our community. We do home health and hospice both, and with home health, the patients have to be homebound. They have to have a difficulty getting out into the community and making it to the doctor's offices or the outpatient at the hospital. And what we do is we send nurses into the home. It can be nursing, physical therapy, occupational therapy, and speech therapy. And we go out and take care of them in their home and provide the services there and help them transition. Most of our patients are discharged from hospital facilities, and we help them transition back into the community to where they can make it back into their doctor's offices and the outpatient services area. And then with hospice, we provide end-of-life care. What it means to be on hospice is a patient has to have a terminal diagnosis with a life expectancy of 6 months or less. And what we do is we have volunteers, we have nurses, we have aides, we provide, basically the nurses go in and they manage the care of that patient and help keep them comfortable through the end of their life and help them have quality of life instead of quantity of life. And then what we do is the aides go in and they help with baths and things such like that. The volunteers, we have a wonderful volunteer program here. In fact, we are looking for additional volunteers, so if anybody wants to help out, I'm going to put a plug in there. We need them. But the volunteers, they go into the homes and they meet with the patients and they help take snacks over to the family. Hospice is a program where we provide quality of care for patients at the end of their life. As part of that program, it includes nursing services, home health aid services. We also can provide therapy services if they're needed in the end of the life, as well as volunteer services. As far as hospice services, what we have 4 different kinds of hospice services that we provide. We can do inpatient services, which Medicare requires the patient to have symptoms that are uncontrollable outside of the hospital facility where they can't. So if they're in the nursing home and we can control the pain or the discomfort there, then we're expected to manage them there. If not, we can move them into our hospice inpatient suite where the family can be close by their side at the same time as those severe symptoms are being managed. Then we have routine home care, which is done in the patient's home. We provide the hospital equipment such as a hospital bed, oxygen concentrators, things like that, where the patients can be comfortable in the comfort of their own home. We also have respite care. Respite care is the where, say, a loved one needs to go out of town and they don't have anyone else to care for the patient. We can put them in our hospital suite for 5 days under respite care and help take care of them at that point. We also have a room at Senior Village Nursing Home and one at the Seasons that we can use for respite care as well. And then there's continuous care, which continuous care, a nurse has to be in the home and the patient has to qualify for at least 8 hours of care per day. One of the biggest benefits to hospice is the patient and the family are not alone. You have a support group behind you helping you through the end of life process, and we're here to answer questions. We're here to help you in whatever needs you have. Just a one small thing going out, we had a volunteer who had tapped into one of the patients who had been an artist in the past, and she had given up all of that, so she took coloring books and colors in with her, and they sat there and they had quality time, and the patient themselves, they were forever grateful for that volunteer. These are just, that's one of the many things that we provide here for you and your family, so please reach out to us. We're here in whatever capacity you need us. Here at the hospice agency, we always need volunteers. I would encourage you, if you would like to help in your community, this is a great way to do it. We have patients who just need some interaction with others. Our volunteers they can go get their favorite snacks and bring them and drop them off to them. They can sit and let a loved one take a nap in the middle of the afternoon that they haven't been able to do. There's no patient care provided by the volunteers. It's merely emotional support, and it's needed more than you know in our community. Also, we have administrative roles within the volunteer program where they help send out thank you cards for donations. They can help with just the bereavement letters being sent out to the family and things like that. So there's a wide range of opportunity within our program to reach out and help your community. And we'd love to have you do that. If you want to call me directly, feel free to do that.
Hi, I'm Tracy Martinez. I'm the manager of the Seasons Assisted Living. So the Seasons is a home. We want to make life easier for the residents that come in, the people that come in. We want their life for them to live carefree, where they can just come and go and do what they really enjoy to do or they want to do. But we're also there if they need extra help, if they need medication management, or if they need just a little extra this or that, or come in and clean their apartment, or we come in and just be there for them whenever, at any time. We're there 24/7, and someone's always there. It's our passion. We offer 2 apartments. One is a studio and one is a 1-bedroom. Both have walk-in showers, which is really nice. They both have fairly good sized closets, and they both have a kitchenette with a full refrigerator, microwave. You can bring in a few things, but we offer the 3 meals a day. We offer breakfast, lunch, and dinner. We also do a snack bar during the day around 2 or 3. And we always try to make sure if anybody feels hungry or feels like they want coffee or hot chocolate, we provide that. We make sure that they get their wants. We kind of spoil, yes, but that's okay. It's all right to be spoiled every once in a while.
Absolutely.
We also have a store on site that has a few odds and ends little things if the resident doesn't want to get out. Well, per COVID. Right now, the activity director goes and does their little shopping for them. But there are things in the store that they can get. We also have a beauty shop. It's there. They come in and get their hair done. About every Tuesday, everybody comes in, and on Mondays, we have to have perms too, so we get perms on Mondays. The Seasons has a lot to offer. We have different activities. We go on bus rides, things like that. After COVID is over, hopefully we'll be able to go back out and do those things. And we do evening rides where we can go and get the half-price shakes at Sonic and get drinks, and then we just go riding around town and looking and seeing at the things that have changed. A lot of residents like to go back past their homes, and we do that also. And we ask questions about what all happened in their homes. And it helps us to get to know the resident even better. We have several different holidays that we celebrate. And Valentine's Day is coming up, so we're going to crown a new king and queen for February, for this year, 2021. And then we also do Easter egg hunts. We also have pre-COVID, we also had the seniors come through and do a walk with their robes on. It was really neat. At prom time, a lot of the seniors and juniors would come in with their beautiful dresses on and their tuxes and prints around the residents, and the residents really loved that also. We have church services pre-COVID on Sunday. Every Sunday at 3 o'clock there's a different church that comes in and does a service. Now we do things online or on TV. We set up something. We have movie night, which is fun because we kind of give them a little, what 3 movies they would like to see, and they pick what 3 movies. And so we've watched Fireproof, Courageous, Facing the Giants, things like that have really been fun. I can only imagine they really like that movie. And so we pop popcorn and have a Coke, and we watch the movie, and then we visit about it and see how it works in their life, and they also teach us what can work in our life. So they teach us more than we teach them, which is really neat. It is an honor to watch each resident and staff become close and become family. The staff really watches after the resident and makes sure that if there's any changes, they let the nurse know, or they let me know things, and we make sure that resident is taken care of to the fullest. We know that everybody has different times that they would like to sleep, or they would like a snack at different times, and that's okay. We cater to that, and the staff knows that. The staff knows, well, this person needs to just walk around and talk a little bit, and then they're able to relax and go to sleep. There's things that they always have done throughout all their years, and they want to continue doing that, and we want to allow them to continue doing that. That's how we learn. They teach us more than we do for them. It's an honor. It's not a job. It's way beyond a job.